Okay, this is a taping technique for Patella femoral pain syndrome. PFPS is typically feels like quite a deep pain coming from within the joint, and what it is a maltracking of the patella and the pain caused by that. So what this technique does is it tries to stabilise the tracking of the patella. We need 2 strips for this. The first thing we need to do, what we need to identify, is the tibial tuberosity. So if you come onto your knee, onto your kneecap, and then come straight down, you'll feel it sink onto the patella tendon, and then there's a bony prominence right at the end, just sticking out. This is the tibial tuberosity. Okay, and what we need to do to measure our tape is tibial tuberosity to the knee, and then an equal distance up to the quadriceps tendon. So I've measured my tape like so. Then to cut the tape, it's slightly different from the other videos I've done. What we do, as always, first is round off the end. Try and stop the tape catching. So we've rounded off one end, and now at the other end what we're going to do is we're going to cut the tape straight down the middle. Straight down the middle, so you end up with 2 legs to it, and we're going to stop about 1 inch from the end. So a little bit more. So left with something like this, and then these 2 legs we've created, we're just going to round off as well. So, and like so. Okay. So now our first strip, we're going to start, like I say, if you come an equal distance up onto the upper compartment of your thigh in the centre, what we're going to do is we're going to break off, we're going to rip the backing off so that the legs are still attached, but we've just exposed that last inch that we left. Peel that off, and then we're going to lay that down onto the thigh. Securing this with 2 fingers, we'll take one leg, give it a light tug to break the backing, and lift the backing up. So we're just pinching it at the end. Then we're going to lay it down, hugging the knee with little to no stretch around, and we're going to cross over the tibial tuberosity. Repeat the same on the other side, little tug, lift up the backing, hug it round and round, and cross it over, like so. Take the backing we ripped off and give the tape a rub. The heat activated glue, so by giving it rub it will heat it up. And then we take a second strip, which I've cut in the exact same manner, and then we're going to rip off that bottom portion. And this time we're going to lay it over the tibial tuberosity, like so. Okay. Little tug to break the backing. The knee's flexed at this point, sorry I should have mentioned, to 90 degrees. So we've got a flexed knee, and we're laying the tape with little to no stretch, bringing it round. One end, little tug, lift it up, bringing it round. Little to no stretch, and no stretch at all at the end, crossing over. Again, activate the glue, and there you go. Let me show you another view. So there's the knee taped, and that's taping for Patella femoral pain syndrome.